I was really excited when Brad reached out to me and asked me to come today and chat with you all about how we've been tackling misinformation at Science Up First, which is a national anti-misinformation initiative on social media in Canada. And so I've given different variations of this talk a couple different times. So basically, today I just wanted to talk about tackling the misinformation during the global pandemic. For me, being in Canada, it's always important for me to start my talks with a land acknowledgement. So I just wanted to share that with you, that I am joining from Toronto, which is traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. And I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So I'm not quite sure how you folks do it over there, but over here we like to usually start with a land acknowledgement, just to acknowledge, the space that we are occupying. So this is, who am I? I usually like to have this slide up for various audiences, but I am a trained scientist. I completed my PhD at the University of Toronto. I was in a very cool bioengineering lab where my research focused on diabetes-related research. So using some microfluidics, so some bioengineering techniques to try to figure out whether a type of treatment can be used to help for type 1 diabetes. But of course, during my journey, my PhD journey, I got hooked in science communication, because for me, it was really important that I was able to, bring the science to the public. I had a knack for it and I really enjoyed it. It really, got my gears going. I really loved it. So I did a lot of science communication during my PhD, and then just ended up sort of doing it on the side, and then got called on to do lots of different science communication type events and things. And so I'm currently the science advisor for Science Up First and our community partnerships lead. Essentially what that means is within the organization, I help with different topics that we come up with to create posts for our online campaign, as well as I help to vet a lot of the content that also comes out of Science Up First. And of course, in the nature of having gone through a graduate degree, I'm always excited whenever there are conferences coming up. So I'm often writing proposals and submitting for us to attend different conferences. So like I mentioned before, a couple of the slides I'll just go through a little quicker, but I have the typical required slides of the infodemic, the WHO declaring the mass rise in information during the pandemic as an infodemic. So I'm pretty sure those of you on this call and those who will listen in will know, what the infodemic is, but in case you don't, here is a slide on it. But essentially, having a lot of information, which can be extremely overwhelming for a lot of people. I mean, it was overwhelming for scientists. It continues to be overwhelming for a lot of experts, so much less, the general public. And then misinformation. So we know misinformation as false or misleading information. But I also like to make the distinction, of course, between mis and disinformation, because disinformation, we talk about it being deliberately created and shared with the intent to harm, whereas misinformation is usually misleading. And so we like to have that distinction, especially because typically the non-expert public, a lot of people who are not aware and they just, they're just clamoring for accurate information. They didn't have access to this information. And whenever they might stumble across a piece of misinformation because they're, unfortunately not having access to accurate information, may share it. And that will not, be their fault. So we like to just make that distinction between the two. All right, so the Disinformation Dozen. Again, so this was a group of 12 people who were responsible for the bulk of misleading claims and pretty much outright lies during COVID-19 vaccines. This proliferated a lot on Facebook and Instagram and Twitter. And they were actually found to produce about 65% of the shares of anti-vaccine misinformation on different social media platforms. So the claims from this, dozen, they range from pretty much denying that COVID exists to claiming that false cures are in fact the way to solve COVID, talking about 5G, etc. So, this dozen did a lot of harm, and some of them, fortunately, were removed from certain social media platforms, but were not from others. So these were just, this is one example of, a massive campaign of spreading of disinformation during the COVID-19 pandemic. And don't have to tell this crowd, but consequences of misinformation, right? People were not following public health guidelines, right? Increase in vaccine hesitancy, but I personally like to talk about it as low vaccine confidence, and then risky behaviors that were causing people real harm. So, people going to vets or different stores to try to buy ivermectin and use it on their own without a proper prescription, that was one thing happening. People consuming bleach, it was getting really crazy out there. So we know that that's one of the consequences of misinformation. So again, I typically prefer to use the term low vaccine confidence, but I know a lot of people talk about vaccine hesitancy, and we know that it is a complicated issue. There are very many reasons for why people would have low vaccine confidence, but obviously misinformation was one of the main drivers for this issue. So this here, I won't get into too much about it, but this was essentially a table from a Canadian community organization where some of the research they found, they were looking at different communities, especially racialized and marginalized communities. So whether they were like the Black, Latin, and immigrant communities, and looking at, their vaccine confidence levels, which was, to no surprise for us, their confidence levels were much lower compared to others. And then here, going over this super quickly as well, this was from the Angus Reid organization, but basically, this is data from 2020 going into 2021, looking at the vaccine confidence levels. Obviously, the last part of this graph here, I have it blacked out for now, but basically it was just showing that people were having low levels of vaccine confidence. So again, some reasons for these low vaccine confidence levels, right? So distrust in societal structures, right? Government, healthcare, news, so much of this, if any of you had done any of this work during the pandemic, you would have come across a lot of distrust, especially if you were talking to people who, just in the community and not even on social media. Lots of distrust due to issues that lots of other communities have faced prior, especially racialized communities. Again, misinformation and disinformation. Another huge one in my work as well was lack of accessibility of accurate information. Poor communication from the top down. So there were a lot of different organizations who unfortunately did not communicate very well, and that led to a lot of distrust in the general non-expert public. And then, science literacy was an obvious one that was shining throughout the pandemic. I think a lot of people, because they're not caught at a certain level in school, critical thinking and science literacy is very low. And I think that became very apparent during the pandemic, especially with people not being aware of how science works and how science moves forward. So those are just some of the reasons behind that. And here, now kind of switching gears a little bit to social media, and its role in misinformation. So this was a poll that was carried out in healthcare workers, and this actually, I believe, was in the States. And it was showing here that, how much is it? It's like over 70% of the respondents, they said that their patients were receiving misinformation from social media. So we knew about friends and family, online in general, whatever, and the rest of the local news, etc. But social media was definitely playing a huge role in this information that was being spread. So just going back now, talking a bit more about misinformation on social media, obviously anyone anywhere can share anything, right? We've got access to everything that's open and available. The great thing about social media, though, there aren't barriers, but it's also a con. So it was also reported that Twitter had about 12 million more daily users in the first 3 months of 2020 than in the last three of 2019. So I know personally, I was on Twitter quite a lot. I know a lot of experts are on Twitter, and a lot of people tend to go to social media to get their information. And then much of the misinformation that was spreading on social media also included the use of bots and, of course, different strategic disinformation campaigns. So how can we combat it, right? First of all, since we know that a lot of misinformation was on social media platforms, we needed to be there. And so this is essentially the origin story of Science Up First. Basically what happened was Timothy Caulfield, who is a researcher at the University of Alberta, and a senator, Dr. Stan Kutcher, who is a senator out in Nova Scotia in Canada. They were both having a chat about, what were we going to do about the misinformation that they were seeing spread on social media. Tim Caulfield is a misinformation researcher, and so they actually started DMing several people, myself included. So they were DMing science communicators, medical professionals, healthcare workers, scientists, social scientists, basically all the experts that they can think about to get them together in order to start to combat misinformation online, basically on social media platforms. So, we have to be where the people are. We have to remove barriers to access, which social media can do. And then you, of course, need to use very inclusive language. So being empathetic and compassionate, two of the biggest things, especially in my personal comms during the pandemic, that have been extremely necessary. And then, of course, using narratives. So we know that people tend to, respond better to storytelling. But of course, we want to be careful if we're talking, if we're using anecdotes, we need to have it, of course, backed by science, right? They have to be backed by evidence, but they also have to be easy to understand and easily digestible. So that brings me back to Science Up First, which actually came together because of these three groups at the bottom. So it's Science Up First is actually an initiative under the Canadian Association of Science Centers. And then our partners, COVID-19 Resources Canada and the University of Alberta Faculty of Law. So it is a national initiative that works with a collective of independent scientists, researchers, healthcare experts, and science communicators. So like I had said before, it was, the brainchild of Tim Caulfield and Stan Kutcher, who got a bunch of us together and said, okay, let's create something, let's create a movement where we can share accurate information online where the people are at so that we can combat misinformation. So where is Science Up First? So like I said, we're online. So specifically, we're on Twitter, Instagram, Facebook, and TikTok. So I know we were chatting a little bit earlier about TikTok. So TikTok for us is actually quite smaller than our other accounts, and we're slowly growing it, and that's simply because of resources. But we have a pretty good following on the other three platforms, so Twitter, Instagram, and Facebook. We also have them in English and French, and obviously that's because French is another official language of Canada, so everything we do them in English and French. So a little bit about how Science Up First works. So I know this graphic here might be a little bit difficult for you to see and discern all the tiny font and writing, but basically what happens is we have a coalition of experts that we bring together. And we have brainstorming meetings every 2 weeks. So what happens during that time, as well as, with other methods, so like social listening data that we collect and we get from like Health Canada and other partners. Essentially at these brainstorming meetings, we talk about what's currently happening. So what are the pieces of misinformation our partners are actually seeing, or or experiencing what are the types of misinformation are community partners. So we have different types of partners, organizational and community. And when I talk about our community partners, I'm speaking more specifically about, the different communities that we serve they tend to be, the marginalized and underserved communities, and getting feedback from them as well. So we go through that process. We try to, we filter the ones that are most relevant and most timely bits of information that we need to put together. Then we have a team, our comms team is made up of our comms manager, a science communicator, and 2 content producers, one for English and one for French. Our science communicator goes in, does the research, and writes the content for the post. That content is then vetted. So by that coalition of experts, we tend to pull different people with different expertise for different posts, and we ask them to vet the posts. These posts then go to our content producers that then create the very cute and cool graphics that we have for our posts on Science Up First. And then after that, it gets posted online. So then we share those posts as well with our community partners and different partners, in an effort to get them all reshared and retweeted for high engagement. So, this is kind of like our tagline. We share the best available science in creative ways to stop the spread of misinformation. And I know, of course, the emphasis right now are, on science, creative, and to stop spread of misinformation. But for us particularly, obviously, because we need to be sharing accurate information, information is always vetted by an expert in the field. And it always has to be right now at a grade 6 reading level, so it can reach people who can understand the posts that we have. They also need to be creative, otherwise we won't catch people's attention. So I won't go through this list here, but this is just an example of the way in which we create and share our content. Like I said, providing trusted sources, using clear and shareable content, emphasizing content that is inclusive and respectful. It has to be engaging, and it has to be engaging as well. So this is a little bit of what we do in terms of how we combat misinformation. So I like to think of it in 3 different ways, and I'll go through each of them. So first, we share accurate information. So right off the bat, from those meetings that we have, those brainstorming meetings, we talk about topics, it's not all about, okay, what is misinformation being spread, but it's also like, what is timely, what's happening right now, or what is going to happen. And then our team create these posts on these topics. So we just share accurate information. Again, it has to be, compelling and engaging and interactive. So that's what we do. So these are a couple of the different posts that we did, and these were not in response to any specific piece of misinformation or a debunk, but just basically just information that we wanted to share. Some other ways, of course, that we share accurate information. So we've had a few different social media campaigns. We had one for WHO Immunization Week, Kids and Vaccines Day. We had a Kids and Vaccines Day campaign. We've done tongue howls, and we also support our community partners. So when I say support community partners, one example of this is, so we've got a community partner that serves the South Asian community here. And one way to ensure removing barriers to access of information is to get some of our content translated into different South Asian languages. So that's one of the ways in which we do that. So the second way in which we combat misinformation is to actually debunk the misinformation. So there is research, talking about debunking misinformation and whether or not it is effective. It is effective for the most part. There is, of course, some research that, will say contrary, but for the most part, it has been found to be effective. So for these ones in particular, I chose these 3 examples. I don't know about you all, but we were constantly hearing about, oh, natural immunity is better, than vaccine-induced immunity. So that was one of the posts we did. Just another post on just, how you'd be debunking misinformation. Oops. And then also, so the first one, this one was very interesting. A lot of people were talking about, but essentially the number of people who were getting COVID, who were vaccinated, were still larger than those who are not. But obviously they're not taking into account the base rate fallacy. So that was something else we thought was really important to talk about. And then lastly, I would say the third way in which we combat misinformation is through educating the public. And so we do that in 3 different ways. So we teach them about misinformer tactics. So I have an example here, talking about false dichotomies. So basically, presenting information to people saying it's either a Black or a white situation where we know there's a lot of nuance. We also, try to teach people about conspiracy theories and how they may come about. We also create posts on how to spot and stop misinformation so that people wouldn't be sharing misinformation unwittingly. And then talking about how to communicate with loved ones is another really important one. So we had a post about calling in instead of calling out. So it's just a way to be compassionate with your communication with loved ones instead of making them feel judged and cornered, which, as we know in research, has found not to be helpful. So that's a third way in which we do that. So how are we doing so far? I just wanted to share, I guess, a bit of metrics with you all so you have an idea of, okay, so we're doing this social media campaign, but how is it actually working? So January 27th, we had this National Kids and Vaccines Day. So these are just a couple of the metrics here. Suffice to say, it did rather well. We did partner with a few different organizations across Canada, including some of our community partners. And we actually got Justin Trudeau and Dr. Theresa Tam, which is our chief health officer, to engage with our social media content and retweet and reshare. Of course, with these very popular political bodies, lots of trolls come with that. But at least we were able to get a lot of exposure for this particular event. So we had a town hall with a few different experts. It was about 60 minutes long. We had pre-decent registration. Again, like 5,300 plus posts, 25,000 plus engagements, and 37 million impressions. And these are just a few more metrics. So suffice to say, we've been growing a lot ever since we had started. And we started this campaign back in so our pilot of this campaign started in January of last year. And then we actually managed to get funding to have a proper team in place, and still a very small but nimble team. And we all started in April of last year. So it's been a year and a little bit since then. We also like to share and know that we are actually engaging and interacting with real people and not bots. So we try to collect whatever feedback we can get from people. Of course, we like to share the really good feedback we get because we know we're actually making some kind of difference, and people are actually appreciating the content that we are sharing. So this is just a little bit more on the audience side. So like I said, we're on Twitter, Facebook, Instagram. We haven't captured TikTok here because we're not very big on TikTok, and we haven't put a lot of focus on it right now. But we've got a pretty decent following on each of those platforms. Of course, we can only right now separate them by men and women. And then we have like a tiny bit of the population in there that identified as non-binary or didn't specify. And then we also capture our audience from the different cities in Canada on each platform. So anyway, at the end of this, so that this will bring me back to the graph that I was talking about previously, where we started to see, thankfully, that vaccine confidence actually started to increase after a while. And we would like to think it was because of a lot of different initiatives, such as ours. Obviously, we're clearly not the only one, but lots of different initiatives, lots of different community initiatives and small initiatives, non-governmental ones that actually, sort of jumped in to fill the gaps of, when it came to communication and giving people what they were looking for. We'd like to think that we played a part in that as well. So anyway, with that, I wanted to say, I know that Brad mentioned too, yeah, we do have a YouTube channel as well. But if you did want to connect with me, you can, email me. I am on Twitter, but you can email me at krishana@scienceupfirst.com. And so if you are interested in being involved, what I'll say, there are two specific ways at the moment that you can do that. So we have, like I mentioned to you before, a coalition of experts. So essentially it's almost like we're collecting a bunch of experts, of people who have expertise in different fields. Now, although we started during COVID, we ensured we didn't name ourselves COVID anything. So we are called Science Up First because the basis of our work is around misinformation. And so with that, we're actually currently continuing to cover COVID, but we're slowly pivoting to other topics. And so one of the topics that we'll be covering eventually will be climate change as well. But basically any science or health misinformation, we're always looking for experts. So if you have expertise in any area of science or health, we're more than happy to have you join our coalition. So basically, if you're part of our coalition, what that means is you can attend our brainstorming sessions and share with us, all your ideas and things. We also look to our coalition to be experts on panels or interviews or talks that we need to have or that we are invited to do. And also vetting of the information. So we have a few people who are part of our coalition who are vetters all the time for posts, and then we go to specific ones who we may not have interacted yet or who have different expertise that we do need for vetting of posts. So those are two main ways I would say, if you are interested, that you can be involved. Just FYI, when it comes to the vetting, we do supply a small stipend for your work. But if you're part of the coalition and you're interested in giving talks or being parts of panels or whatever, that is not paid for. That's usually, people doing that of their own time. So yeah, I think with that, I'll stop it. And I know we're at 7:10, so we have about 20 minutes to chat if people had anything they wanted to chat about.
Can I say something? So I'm curious, have you been having issues around monkeypox? And because I've been seeing some very strange things, and do you have plans for dealing with that?
Yeah, we do actually. Let me share this. So I think we do have a post out on monkeypox. Yeah, I know there's some misinformation that started going around about monkeypox. So I think we have a video here actually of monkeypox. I'll share the link. But I'm not sure at the moment how much more we're intending on covering it. But what I suspect is the more misinformation that comes up around it is the more likely we will continue to cover it. But basically, we did have one video on it so far. I just shared the link in the chat. I could share the screen too if you wanted, but you can always check out the link in the chat. I think, is it Caitlin? Yep.
Yes, hello. I'm formerly
Hi.
Katie. I signed out of my phone and into my computer.
Oh, it's Katie. Okay.
So I have a lot of questions because my office actually, we're in the process of putting together a program that is like essentially everything that you're doing. Like trying to bring in a lot of experts, talking with community leaders to combat misinformation, disinformation, get health communications out there. It's all in the planning phase right now. So I'm wondering, like, if you had like a dream project of coming from the government down, what would that look like for you? And maybe I can relate it back to the team and see if we can incorporate any ideas.
A dream project from the government down.
Yeah.
Honestly, I think so the reason, I mean, if there was something like what we were doing right now from the government, I think that would have been a whole lot. It would have been extremely helpful. But I will also say this too. I mean, if it is at all possible to kind of make it a separate project. So, I mean, it could, you know, it's government funded, but it can be run, you know, independently in some way. I think that would be helpful. And I say that because, you know, at the end of the day, when we're dealing with a lot of this information, and depending on, you know, whoever your target audience is, the trust factor is so huge.
Yeah.
And because a lot, you know, even though our government and our, you know, our official governmental agencies and Health Canada was, you know, sharing information, quite frankly, people, you know, there are people who don't trust it for obvious reasons. And so they tend to go down the rabbit holes of misinformation. And so we, although I will say, you know, although we were actually funded by Health Canada, we acted very independently of them. We, of course, you do have to share, you know, you have to be transparent and share where your funding is coming from. And we had like a little bit, I would say we had a bit of backlash, not too much, thankfully. But people pretty much saw us as a very separate entity. And so what I would say is, yeah, I would say absolutely do something like this, because if, and again, it depends on the audience, right? So all of science communication is always about your audience, like who are you trying to reach? If you're trying to reach the non-expert public, do stuff at a grade 6 reading level, you know, make it super engaging, make it really easy to read and understand. Of course, not dumbing it down, but just, you know, using simpler language, because no one likes to be spoken down to. And also, yeah, and if you can, make it like an independent project. I think that will actually be received better than if they see it as coming from like the US government.
Yeah. Okay. Thank you.
Yeah, no problem. Mabel?
Actually, I had a question that's sort of related to what you were talking about, your target,
okay,
your audience.
Yeah.
I was just wondering if Science Efforts had any plans now or later about targeting people that are hard to reach. I think that like it's easy with initiatives like this to end up like preaching to the choir, and people that like are already interested in all this are the only audience that you have. So I was just wondering if you had thoughts on that.
Yeah, and when you say hard to reach out, what, like which specific audience are you talking about?
I guess like the people that are consuming misinformation or disinformation rather than following the guidelines and recommendations and medical advice.
Okay, yeah. So yeah, that is something we're like constantly thinking about. And one of the ways that we thought to do this is actually to engage influencers. What we found is if you start to engage, so, and then that, even with that can be tricky, right? Because you want to engage influencers who are, they are aligned with what your, you know, initiative is working with, but at the same time, they are capturing an audience that you aren't currently capturing. And so for us, we started to look into different influencers. So say, for example, okay, so we know right now we're capturing a massive part of the demographic that we're capturing is women between the ages of 25 to 55, I believe, and on Facebook and social media, Facebook and Instagram. And so we know we're actually capturing white women within that group. So we wanted to, we were like, okay, how do we diversify? So we started to look at different communities where they weren't necessarily being captured, and started to look at influencers within those communities. Now, because it's a social media initiative, you know, obviously it's communities where, you know, they're reaching their own, you know, the influencers are reaching their own community on social media, which is fine. That's how those influencers work. And we've actually found that to be quite successful so far. What I'll say is, so for example, like going into as well, like Facebook groups with parent Facebook groups is another way to do that, or parent influencers. So I know when it came to kids and vaccines, I will say this, I was very active on social media. I literally sent out one tweet about kids and vaccines. I got trolled to death. And I moved away from that topic because of that issue. But basically trying to engage and interact with parent influencers is another way to, to get to that problem. So for me, talking about that was just me personally, but from a Science Up First perspective, the influencers we found to be quite helpful. Also, we've done a few events with our Indigenous communities here. So a few different Indigenous communities. We also engage influencers. Now, of course, when you're engaging influencers, that requires money. So that will require funding. So that is something to look at. Also, the way in which you word your interaction or your engagement with the influencers is also something you have to think about, because people will obviously always be constantly looking and critiquing to see, we're trying to battle misinformation. So if they feel like, these people are in our pockets, they're going to think, well, they're going to say whatever we ask them to say. So I would say with that particular one, the challenge is just being cautious of how you approach it and how you word that partnership or that collaboration. But yeah, I would say influencer is a big one. Try to infiltrate the places where, well, obviously your group will need to do the analytics of what's actually happening. Like, who are you currently capturing? Who do you want to capture, and how can you capture them? For us, it was using the influencers in the different communities was a huge way to do that. But I also do a lot of work on the ground and not on social media. And so again, that is connecting with leaders in the different communities who are influencers in their own right. They're just not social media influencers, but connecting with those leaders makes a big difference as well.
I mean, that makes sense. Like, even though the US government has started figuring out their own way of using influencers and artists to talk about different messages. And kind of related to that, I was just wondering how this organization views the interaction between like politics and science communication. I mean, obviously a lot of us have a background or work for the government, so there's a very defined line there. But now that like a lot of medicine and especially vaccine hesitancy has become like politicized, the line has shifted a lot from.
Yeah. So basically at Science Up First, we actually try to stay out of the politics of it, which I know it's difficult, right, as it is, but our board has decided that it's, we prefer to not get into the political arena of it. So when I say that, it's, we try not to comment, for example, if and I'm sure you folks have seen this over there, of course you have, misinformation being spread by politicians or, any kind of, they're celebrities and political people and they're spreading misinformation. Over here, the approach that we've taken to that is literally debunking the misinformation without calling out the people who are actually spreading it. So Science Up First, as it is right now, we don't actually get involved in the politics of it or call out any politician or for that matter, we don't call anyone out. I don't know if you remember that. So I was talking about that slide where we create content for people to talk to loved ones. Now, although these are not loved ones for us online, we still want to treat people with empathy and compassion. So we tend to take that approach with all our posts. We don't call anyone out on misinformation, for example, that they share. We just correct the misinformation. So that's our stance on dealing with the politics with vaccine hesitancy.
That's very interesting. I have a lot of follow-up questions, but I'll let Brian go.
Sure, yeah.
Thank you. This is really interesting. I'm curious maybe a little more on how you actually select what particular misinformation to target on a given day.
Yeah, so I mentioned before, so usually we try to make it timely. I find, well, not I find, but the team finds that that's the best way to go about it. So there were a few different posts we did. One was about, of course, the chemical in the vaccines, when wasn't there a piece of misinformation like that. And that one, actually, we found that post didn't do as well, although we thought, oh, maybe this would be, the thing that people were talking about a lot right now. Versus, say, for example, when people were talking about ivermectin. We sort of jumped on that immediately to create content for that. So that's where I think having a nimble team comes in really handy. So although, I mean, like I said, we have layers to what we do, obviously. Things have to be vetted. So that is a little bit of a limitation in terms of time, I guess you can say. It slows us down a little bit, but our team is not so big that we can't jump on content very quickly, get it vetted very quickly, and then out the door. So I think the biggest piece to that, I would say, is timeliness in the pieces of misinformation that we hear. Also, in the brainstorming meetings, if we've noticed, so for example, several of our partners mention the same piece of misinformation that they've been hearing in their circles as well, then we know, okay, yeah, this is something we should definitely jump on. It's also getting like a lot of traction in the media and things like that. So if all of those pieces come together at once, that's kind of how we decide, okay, we will be tackling, these pieces, within the next week or two. That's usually how we do it.
So I'll chime in with a question here. I'm kind of curious about scalability, and it seems now kind of, people have called it like the post-information age or the post-fact age, right? And a lot of these, if you think about, information as like a tree, right? Seems like a lot of the things that we're talking about addressing are like branches on the tree. And like maybe the root of that tree is in the post-information age, people are just really eager to believe something that confirms their bias already. And so I'm kind of curious if Science Up First has thought about maybe how to address the root of that tree, and that is to have people maybe hesitate to believe something because it's convenient to believe, and maybe, reevaluate or find a way to make people maybe better or more engaged learners, if that makes sense.
No, that's an excellent, so yeah, I mean, like you said, we can try to fight everything as it comes, or we can try to attack the problem at the root, which, to be very honest, either one is extremely challenging and difficult. So we're taking two approaches to that. So one is the content that I mentioned. We, along with the debunking of misinformation and sharing the accurate information, we do bring out content to say, okay, the power is in your hands, right? These are different ways, and these are different tools or techniques that you can use to spot and stop misinformation yourself. Figure out how conspiracy theories are sort of born, and basically educating the public using the posts. And so actually another way, and we've actually been getting a lot of these requests lately from different organizations, is pretty much oh no, I'm blanking on the term, capacity building. So basically, people have been wanting us to create workshops on how to spot and stop misinformation. And so we are actually currently looking into creating some of those workshops. So I know there are people around who do this, but I mean, this is not what we started out for, but if it's a need, we wanted to see if we could fill it, and we do have the capacity to do that. So we are creating some workshops on misinformation, basically how to spot and stop it, what to do, and the conversations and things like that, and helping and we'll be giving those workshops to the different organizations that have come to us to ask for that. Those are the two ways that we're tackling it right now. But other than that, we definitely can't do it alone. It's such a massive thing to do. So every other organization that's involved in it, we need everyone, all hands on deck when it comes to that. But yeah, that was a good question. Definitely trying to look at the root cause and trying to educate people so they can do it on their own, I think is really good.
And then kind of related to that in terms of scalability, you were showing like the work stream for how Science Up First works, which is like a tweet comes in, and then there's like a bunch of scientists or whatever social media thing comes in, a bunch of scientists vet it, and they come up and they say, this is misinformation, and we're going to create this graphic. And from what I've seen in documentaries about the effectiveness of these bots and these tweets and how quickly they spread and get shared, it seems like an insurmountable task to have a group of scientists vet every single misinformation tweet and those misinformation tweets are just like going wild. So like, is there a automated way, or maybe a data heavy or a way or some kind of algorithm that Science at First is thinking about to kind of capture these things as they're happening? Because it seems like insurmountable to have a team of scientists address every tweet.
Oh yeah, for sure. And so that's actually not what we were doing. So I'm
Okay.
happy you brought that up, because then that means that perhaps I didn't describe that properly. So essentially the workflow is, like I mentioned, we have these the biweekly meetings that we have, as well as information that we capture. We get that information from, for example, like Health Canada, that tells us, you know, based on searches that happened this week, you know, these are the top 5 to 10 things people are talking about. That comes from that research. And then from the brainstorming meetings, we also, collect information from our partners, and, most times they match with the search results that we've gotten from the other organization. And that's how we determine the content that we want to create. So whether that be just sharing accurate information or combating misinformation. No, we definitely don't have the capability to counter every piece of misinformation that comes in. We wouldn't have the capability to do that, although that would be awesome. What I would say though, right now, I think, the best place for that to be handled is literally on the social media platforms, right? So like Facebook and Twitter and Instagram, all sort of putting in these, the countering misinformation measures that they've put in during the pandemic. Now, mind you, obviously they're not the best, but they're still better than than not having anything present, because as we know, a lot of misinformation, particularly on Facebook, has been spread in this pandemic. So when they had, again, it's not the most effective, but still better than nothing, because I do recall myself and even some colleagues trying to share accurate information on Facebook, and then our post got flagged. We're like, okay, but we're not misinformation, right? So yeah, I would say, right now that's, I would leave that in the hands of the social media platforms. Something like that, though, I believe Tim Caulfield's group is, so they're working on a data-driven, I wouldn't say solution, but way to look at all the misinformation coming out of the tweets. I don't know what the outcome of that will be, but at least for now, they're studying what's being said, and I know many other places and researchers are doing that. But encountering it, I think that will be quite challenging, but definitely not impossible.